I am Sanchi and she is Rahima. We are students of PGDI and we are honored to host this seminar today. Before we begin, I would like to take a moment to introduce MAA Research Foundation and MAA Institute of Speech and Hearing, established in 2014 and 2019 respectively. Our institution provides comprehensive services to patients, students, and the community. MAA Research Foundation is an NGO dedicated to awareness and research, while MAA Institute of Speech and Hearing is a premier institute offering specialized courses in early intervention and speech and hearing sciences. Recognized by the Government of Telangana, Rehabilitation Council of India, and Osmania University. Notably, our institute holds a prestigious Persons with Disability certification, demonstrating our commitment to inclusivity and accessibility.
Our vision is to build an inclusive society where every child with developmental delays or disabilities receives early support, empowering them to achieve their full potential and lead an independent, dignified life. It's an honor to have you all here today, especially during Autism Awareness Month. As we gather, we recognize the importance of promoting acceptance, inclusion, and support for individuals with autism and their families. This year's World Autism Awareness theme, Advancing Neurodiversity and the UN Sustainable Development Goals, resonates deeply with our mission. We are honored to have 7 renowned keynote speakers joining us, each bringing their expertise and insights to the table. So, Sanchi, what is early intervention?
Early intervention refers to a range of services and support designed to promote healthy development, prevent delays, and provide support to young infants and young children. It encompasses intervening, preventing, and supporting children. Notably, early intervention starts even before birth and continues up to 6 years of age. The key members of the early intervention team includes early interventionist, pediatricians, occupational therapist, speech therapist, psychologist, and psychotherapist. Throughout this program, we'll explore various topics including guidelines on establishing clinics for rehabilitation, early identification and intervention in autism spectrum disorder, and more.
As we begin this program, I invite you to engage, share, and learn from one another. Let us harness our collective knowledge, passion, and commitment to make a meaningful difference in the lives of children with neurodevelopmental disorders. Thank you for joining us on this important journey. Together, we can create a brighter, more inclusive future for all.
It is my pleasure to now introduce our Chief Managing Director, Srimati Sunita Kumar, a visionary entrepreneur, philanthropist, and humanitarian. She is renowned for the empathetic approach and pioneering work in the field of rehabilitation. Her most notable contribution is the establishment of MAA Rehabilitation Center, a beacon of hope for marginalized communities. This free rehabilitation center provides vital services including speech therapy, special education, early intervention, behavior modification, occupational therapy, and physiotherapy to underprivileged children. Her selfless efforts have transformed the lives of over 50 children who avail of these services daily.
Through her tireless work, she has demonstrated an unwavering commitment to inclusive and accessible healthcare. Her vision for a society where everyone has access to quality rehabilitation services is truly inspiring. And now, it is my pleasure to invite our CMD ma'am to address the gathering.
I think we are delayed by about 20 minutes. Apologies for that. There was a slight issue with the PWD Assistant Director called back to the office. He was actually supposed to come and report here, but because of Babu Jagjeevan Ram's Jayanti, he was called back to the office, hence the entire schedule was hayway, but thank you for having the patience of being with us. Ma'am, thank you for accepting and being here. So autism isn't a puzzle to be solved, right? It is a story to be understood, respected, and celebrated. Autism doesn't need a cure. It needs acceptance, inclusion, and voice that will not stay silent. So thank you all for being here today, joining us to celebrate the Autism Awareness Month. More than a reminder on a calendar or a day to be celebrated, I think it is a reminder for us to make sure if they are all inclusive and they are supposed to be one among us, treated with compassion. So don't take your profession, whoever, I think all of you professionals are dealing with autistic children and children with different disabilities. I think it's more of compassion which is needed for this field rather than saying this is a degree what I hold. So all the best to all of you, and I'm sure the well-learned teachers will share their experiences and you will have a happy learning. Thank you.
Be it about primitive reflexes or be it about the new practices and sensory processing integration and how each department plays a role, be it speech or be it communicative skills or be it adaptive skills. So it is really helping us to think back, okay, this is what we have learned in our classes and this is what we are seeing in the clinical sessions that we are observing. So it was really a great take back.
Rajeshwari ma'am, thank you for opening the doors to the fascinating world of neurodiversity with such clarity and depth. Your talk, enriched with relatable anecdotes, was both engaging and enlightening. Dr. Shashikant, we sincerely appreciate your insightful presentation on orthotics and prosthetics. You shed light on the vital integration into early intervention with remarkable clarity. Thank you, sir. Mrs. Pooja, your session on connection between primitive reflexes and neurodevelopmental disorders was truly eye-opening. Your explanation on how retained reflexes influence development was informative and thought-provoking. Thank you for sharing your expertise. Ms. Ridhima, delivering a post-lunch session is no easy feat. Yet you succeeded in capturing our attention and engaging us thoroughly with your talk on sensory processing. Thank you for such a vibrant and stimulating presentation. Mrs. Archana, your insights into communication and neurodevelopmental disorders were thought-provoking. You introduced us to various approaches in speech therapy with clarity and relevance. Thank you for such an enlightening session. Mrs. Sandra, though yours was a last talk, you highlighted the significance of auditory processing in early identification and intervention. You emphasized the urgency and importance of recognizing these signs as early as possible. Thank you for your valuable contribution. And a special word of thanks to Sunita ma'am for your unwavering support and continuous encouragement. Your commitment to academic excellence and prioritization of learning opportunities is truly admirable. Thank you so much, ma'am. I would also like to extend our sincere gratitude to Mr. Jish Chaku, the coordinator of this program. Your meticulous planning, execution, and behind-the-scenes efforts ensured that today's seminar ran smoothly and effectively. Your dedication is deeply appreciated. Thank you so much.
Thank you so much, ma'am, for your inspiring words. We are now pleased to proceed with the main event of the day, our seminar on early intervention and integrative approaches for enhancing child development. This seminar promises to be an engaging and informative session featuring expert speakers and insightful discussions on the latest strategies and best practices in supporting young children's development needs. Let's begin.
I am honored to invite Dr. Rajeshwari to the stage. Dr. Rajeshwari, Autism Early Intervention Specialist and Consultant Homeopath. Dr. Rajeshwari is a passionate advocate for early intervention in autism, combined with her research in child development, has made her a leading voice in this field. Today, she will shed light on the critical role of early identification in enhancing developmental outcomes for children with ASD. Let's give a warm round of applause to Dr. Rajeshwari, whose dedication to improving lives through early intervention is truly commendable.
We are unable to stop them being born with autism, but definitely we can catch them early, at the earliest, and we can try to flip the case. We can help them to lose the diagnosis. See, like before the age of 3, we need not label them with the diagnosis. See, like we all would be tending to go with the DSM-5 criteria, that at least in India we can talk like this. So I have seen cases coming from abroad and all, no, they will not even utter the word that your child is at risk for autism. Okay, we have at least that much independence here. So we can say that your child is at risk for autism. So, and you have to justify also. For that to do, you should know what is normalcy. if you have to identify what is something abnormal in the child's development, before that you should know what is normal development. So whoever is stepping into whatever rehabilitation courses, it is very much necessary. That is why always there is a psychology as a subject where you will be learning the child development and normal protocols of the child development. So unless and until you know the normal development, you will not be identifying what is deviant in the developmental pattern of the child. Okay, so having said that, see what exactly is autism. See, this is the definition I go, because every child with autism, in the background somewhere they are having some sensory development, sensory integration problem. So I would like to define it this way. Autism is a neurosensory developmental disorder characterized by significant impairment in social skills, communication skills, and associated with repetitive stereotypic behavior. See, like for all the three sectors, the background major problem is sensory integration. From where does the sensory integration starts? What age? From the womb itself. Okay, and anyone like would like to see, I would like to make it little interactive because internet has taught you so many things. So let me see one thing, which is the one sensus which is matured at birth. At birth, hearing. Okay, so you all are speech and hearing experts, hearing. But from the womb, which is the sensory area which is matured first, you know, that is vestibular system. Vestibular system. See, everything is need based. Everything is need based. Why the baby needs something, maturation in vestibular system in the womb? Why? Because it has to move around through the amniotic fluid, and it has to climb the uterine wall, come down and take out the umbilical cord which is entangling the baby. So every purpose is having some or the other need. Okay, so when there is need, we emerge with some solution, right? Like so, the vestibular system is the first sensory system which is getting matured, and child learns to have the baby movements inside, and so embryo will be moving around and it will be making the way clear. And this is the pattern. Usually what happens, like misunderstanding the symptoms, then incorrect interpretation of the early signs. See, like one example I would like to give. See, if the child is born with autism, so as soon as someone enters the room and switches on the fan, okay, so switches on the fan, it gives you one tick sound, right, like switch sound. So this 4-month, 5-month baby will be suddenly alert and it looks at the fan. Any normal child does it. See, like as soon as the switch sound is heard, so it will be looking at the fan whether fan started rotating. Okay, fine. Even the normal child also does, but these kids who are born with autism, they will be doing it consistently. They will not even stop it even till their first birthday also. They will be looking at the fan as soon as the switch is on. So that itself was a very early sign, because they were interested in rotating objects. Rotating objects. But what we think as parents and family members, my child is having some scientific brain, very early signs of higher intelligence he is exhibiting. See, he is relating the switch to the fan. So we start interpreting, because we would like to analyze in a positive way for our child. If same thing, any small wrong thing happens with the neighborhood child, yes, we will be catching that as a negative thing. But with our own child, we will not be admitting that something is wrong in their development. Similarly, we have, we don't have a, developmental screening periodically. We will be going to the pediatricians and health sectors only for the vaccination and whenever the child is sick. So like child development practice is limited only to the vaccination and prescription. Very sorry to say, but we keep seeing the cases who are coming from abroad, no, like they'll be carrying one big booklet about every visit, every details are there, everything is there, because here population is so vast. So like we will not be able to encompass all those things, all minute milestones, no, they will be mentioning in the baby book. So we are failing that. And even if the parents show the concern also, ki my child is not looking at me, so he's not responding to the name call around 8 months, 9 months, he doesn't want to be carried like for a long time, always he is cranky and wants to play down. So like doctors will not be paying attention to that. So like what happens, like screening becomes fail here. Like we don't have that approach of screening of the normal development for all the areas of development. See what happens, no, if child is, see, fortunately maximum kids born with autism, no, they are not associated with motor delay unless and until it is genetic origin and severe hypotonicity is there. So like maximum are motor minute delay will be masked, and like they will be walking and they will be talking and walking and running by the age of 12 months, 16 months. So motor milestones are achieved for any family if child is walking enough. If they are not talking, they are not mingling with the kids, if they are not enjoying the things what are there around, so they will not be paying attention towards that, because each area of development is so important. So like why it is so important in child development? Because each area gets influenced by the other area, also it influences the other area. Okay, so if one is hampered, so definitely it is going to hamper the other things. Any child with visual impairment, see, congenital visual impairment is there. What is the first area to be getting affected? Motor milestones, right? Because there is no motivation, child will not be getting the neck holding properly, because why it will be looking around and it will be strengthening the neck muscles. It will not be, because there is no, nothing is inviting the child to move his neck, right? So like only it will be sensitive towards the sounds and all. So when motor delay is there, that will be limiting the child to go and reach to the surrounding. So automatically his cognitive deficit will be there, or delay will be there. So cognitive delay ultimately leads to the speech and language delay. So when speech and language is affected, your socio-emotional also will be affected. So means they are all interrelated. So like whenever we are rearing a child, we should see them from or analyze them from all the angle of development.
MPO, Director Robotic Rehabilitation Center. He brings a wealth of knowledge in robotic rehabilitation and orthotic management. As the director of a pioneering rehabilitation center, he is dedicated to integrating technology with therapeutic interventions. His talk will explore the principles of orthotic management and how innovative approaches can support children with neurodevelopmental disorders. Please join me in welcoming Dr. Shashikant sir, whose work is shaping the future for neurorehabilitation.
Good morning all. I bow to the divinity in all of you, and thank you Registry ma'am for your beautiful inputs. I'm Shashikant, certified prosthetist and orthotist with Robotic Rehabilitation Center. How the force to work on and all. So when we talk about orthotics, so orthotics, it's a Greek word, ortho to straighten or align, is a specialty within the medical field concerned with the design, manufacture and application of orthosis. Now the orthosis is the correct term for an externally applied device that is to modify the structure and functional characteristics of the skeletal system affected by different conditions. So when I say about different conditions, those are the conditions where we put or the orthotic intervention is needed. So conditions, basically when we talk about, it's a very simplified way to understand condition wise. Then we have also functionality wise, there will be a classification. So in condition wise, if you see is congenital, traumatic, inflammatory, neurological, and neurodevelopmental, degenerative and vascular conditions. Suppose congenital case where there will be a first case will be a clubfoot case or a spinal bifida cases, or cases with congenital limb deficiencies or deformities with some structural part is missing. So in such conditions there will be certain deformities how we can correct and all. So that comes in the first category. Then comes the traumatic part. So traumatic like any kind of road traffic accident or any injuries because of some accident. Whenever we have certain conditions where there will be requiring some kind of orthosis which will to prevent or to restrict the movement and all. So then comes inflammatory like conditions of rheumatoid arthritis or reactive arthritis conditions where there will be some specific deformities where we need to give rest or allow certain amount of restricted movement to the joint. So those kind of also coming into that. Now coming to neurological and neurodevelopmental conditions where particularly we understand the muscle principles, the force, how it is working on. Then we understand the ground reaction force. Then depending and considering all factors into that, then we'll be providing the best suited design, whatever is needed. Now, up to that is degenerative conditions, like this is because of process of emaciation, or some moment because of the degenerative condition of the age-related issues, so where we'll be providing some kind of support. So that's all. Thank you.
In neurodevelopmental disorders, your words were inspiring and impactful. So now we are approaching the final segment of our seminar. Before we welcome our last speaker, let's take a 10-minute break. This is a great opportunity to just grab a refreshment and recharge before we conclude the program. We'll see you back here in 10 minutes. To invite our final speaker for the day to share their expertise with us. So I'd like to invite Mrs. Sandra to the stage. Let's give her a warm round of applause. Mrs. Sandra, Associate Professor, MAA Institute of Speech and Hearing, is an expert in audiology, specializing in the assessment and management of hearing-related challenges in children with neurodevelopmental disorders. Her work at MAA Institute of Speech and Hearing focuses on understanding how auditory processing issues can affect developmental milestones. Today, she will explore audiological perspectives on poor response to name calls and the implications for early diagnosis.
Good evening all. From morning, you all were listening about neurodevelopmental disorders, its speech perspective, language perspective, occupational sensory aspect, so many related, highly related conditions. And now we are going to talk about the auditory aspects of that. A separate, even though it is a comorbid aspect, but a little separate entity. So my topic of presentation is poor response to name call in this young children. So because it is related to the hearing and auditory system, I feel that we will just briefly look into the complete auditory system. When we say auditory system, it starts from what we can see outside, is from our pinna till the auditory cortex at the brain level. So we can grossly divide the system into two. One is peripheral auditory system and the second part is central auditory system. Anywhere, any dysfunction, any lesion or any pathology from pinna till the central auditory cortex, you can have a poor response to name call in young children. It doesn't matter, it should come only peripheral system or it should come only central system. Okay. So now, peripheral auditory system is outer ear, middle ear and inner ear. So if there is any pathology in this region, what happens? You can have any degree of hearing loss which starts from mild to profound. All this condition, you can expect poor response to name call, or if it is a severe to profound condition, you can expect no response to name call also. If it is that scenario, how will we approach that condition? So if there is a peripheral auditory dysfunction, the early identification aspect is the basic one, or the day of birth of the newborn baby, you can have a newborn hearing screening. So using a newborn hearing screening through an autoacoustic emission testing, you will be able to understand whether child is at risk for hearing loss or not. And once you identify that, you can have a detailed evaluation using physiological test or electrophysiological test like autoacoustic emissions or BERA. Now, if the child is crossing 5 years or 4 to 5 years have completed, then you are having a doubt on the child is having poor response to name call, you can directly perform a behavioral testing called as pure tone audiometry. Now, once we identify, okay, there is a peripheral pathology, there is some amount of hearing loss, then if it is conductive pathology or mixed pathology, you can go for a medical management or surgical management. Other condition, that is sensory neural hearing loss, depending upon severity, you will go for a hearing aid fitting or a cochlear implantation, followed by mandatory auditory verbal therapy. Central auditory processing is the processing of the auditory information, any auditory message which is passing through the neural areas, that is from auditory nerve till auditory cortex. That is called as central auditory processing. If there is any breakdown in any area of this processing, we consider it as central auditory processing disorder. Central auditory processing is highly perceptual. How are we differentiating between two sounds, or how are we differentiating somebody is asking me a question or somebody is commanding me to do something? That is what is central auditory processing. If there is error in central auditory processing also, the main symptom what you can see in neurodevelopmental disorder kids is poor response to name call, inconsistent responses to name call. Sometimes they may respond, sometimes they may not respond, because name call is an auditory stimulus for them. If auditory processing is affected, you can see a poor response to name call. So those behavioral processes identified by Asha in 1995 are these. So the first thing is localization and lateralization. That is, somebody is talking to me from right side or left side, or somebody is talking to me from up side, or somebody is calling me from down. Different 360 degree where exactly the sound is coming from. That is what is localization as well as lateralization aspect. And next is speech and noise. I am in a market area. Somebody is talking to me. There is so much of noise. Still, I am understanding what other person is talking. Next is binaural processing. Binaural processing, how well my 2 ears are working together. Whatever I am hearing from right side and left side, how am I fusing that and finding out, okay, this is what the word I heard. For that, you need 3 skills. One is binaural interaction, another one is binaural separation, and then binaural integration. So in binaural separation, what happens? 2 different messages, you are supposed to give concentration to only one message. Say for example, I am talking here, I am giving a talk here, your friend is talking to you. You should understand that mine is the target speech, so I should give a concentration to the talker, not to my friend who is sitting next to me and talking. That is binaural separation. Binaural integration is mother is talking over a phone and child is crying for milk. So what will the mother do? She will continue talking over phone, still she will give a bottle of milk to the child. So this is binaural integration. 2 different messages at a time she is processing. So these aspects comes under binaural processing. Next is auditory closure. In auditory closure, what happens? Even if some amount of some part of the auditory message is degraded. Say for example, you are meeting your friend outside somewhere, you are asking, did you have your lunch? So sometimes if you are asking, did you have your lunch, by the time if suddenly a vehicle is moving, that message got degraded. But still you will answer them, yes, I had my lunch. How did you do that? Because you have an intact central auditory system which has an intact auditory closure ability. That is, even though some portion of the message is missing, you can understand the whole message and answer to that. In case of central auditory processing disorder children, this ability will not be there. They will not be able to answer us. Next is auditory pattern discrimination. Say for example, I am talking to my friend. See, I saw a cat today. So cat is my target word. C-A-T. It should come in C-K-A-T. That K-A-T comes in that correct pattern. My friend understands that I am talking about a cat. Imagine my friend is having a central auditory processing difficulty. If that person understood it as a-k-t, it is act. So entire meaning has gone wrong there. Whatever I am talking, she is understanding in other way. Imagine there is one portion of message is missing. She didn't hear k, she heard only a and t. So again, she may be expecting I am going to talk about something starts with at. So this aspect is called as auditory discrimination or pattern recognition. The last part is temporal processing. Temporal processing is very crucial for speech understanding, especially prosodic aspects of speech. 3 major things: stress, intonation and rhythm. You are asking somebody, or you are saying somebody a command, you are asking somebody a question. All this varies depending upon your stress pattern, your intonation pattern and your rhythmic aspect of speech. This understanding is through time related aspect of the speech cues. That is what is coming under temporal processing. And even music perception is also a subcategory of temporal processing. Why? Because music is also different timing. The lyrics comes. One is fast number, one is melody, one is a slow one is rising. All this aspect comes under temporal processing. So in central auditory processing disorder, it is identified that the deficit in the central auditory nervous system, it is identified as any one or more areas of these are affected. Then we call it a central auditory processing disorder. Okay. So the lesion is at the level of central auditory nervous system. Second aspect of central auditory processing disorder is any one or more of these behavioral processes are affected. Then you consider it as central auditory processing disorder.
Director of Dr. Maidens in Early Intervention. She is a renowned expert in early childhood intervention with a special focus on the role of primitive reflexes in the child development. Her research and clinical work aim to bridge the gap between the neurodevelopmental theories and practical therapeutic techniques. Let's extend a warm welcome to Dr. Pooja Madam.
Topic to cover. So since I understand there are more speech pathologists here and early interventionists who probably don't have a PT or an OT background, it's quite generic. It's not too technical. Okay, and so I would, so you might have seen a lot of videos for reflex integration because that's the thing these days. Okay, so the most important thing that I would like to teach as a person who's working with babies is that you should really understand the fundamentals. Of course, you can always check how integration works, and then also what not to do. So these are the two things that I'm very specific about. So, so you must have seen the reflex arc 8th standard, 9th standard, you've already read it in biology, right? So it's the same principle, okay? So reflex is always a stereotype response to a sensory stimulus. Now, we all have reflexes, okay? So the primary function of a reflex, can anybody say why do we have reflexes?
They help for the development of the child.
No, I'm not talking about child. Why do we have reflexes?
To protect our
Protection, okay, for safety and protection, so that there is not enough time for the message to be carried forward to the brain. So we have a reflex system which can act on it immediately. Okay. Now coming to primitive reflexes. What do you know? Do you know the difference between a primitive reflex and the reflexes that we have? Primitive is the word. Yeah. So, yeah, like ma'am said, development starts in utero. That is from the womb itself. Okay. So reflexes also are there because as we all know, human babies are the most helpless of most all mammals. Okay, other mammals are usually quite neurologically better because human brain is more complex. The most helpless are the human babies. So, human babies are pre-programmed with some protective mechanisms. Like ma'am said, it's again the need. Okay, so protecting mechanisms which are pre-programmed into the baby, those are these primitive reflexes. Okay, so basically the brain hasn't developed or matured enough to control voluntary movements. Until voluntary movements come, the reflexes protect the baby. So the most reflexes appear, it's a different varied timeline that which they appear, and most important is most of it is integrated by 12 months or max. Everything else is available online. Okay, so you have enough videos on Instagram, so okay. Any questions? Of course it is okay, speech stimulation. What you can do is you can give a little linear movements, or you can give some flexible seating, or you can give beanbag where the child is, feels a little, proprioceptive input. Linear will work, rocking chair will work, or standing and the child is moving up and down will also work.
And so that time the child can attend to.
Yes, that's absolutely okay.
Because that's how the neurotypical children also.
Yeah, that's absolutely fine. There are children who process auditory without even having to look or having to continuously look auditory. Anyway, this is more auditory, language is more auditory, right? Of course it is fine. We let the children move as much as they want. So that's, yes, over time we can achieve sitting tolerance, but we need to wait. Yes, ATN not much, yes. It is important that if it is a normal delivery, it is actually better for the children because the reflexes are there for that purpose to move the baby through the birth canal. So yes, it will definitely affect, but not the only reason. It will affect. Thank you so much.
Of a seminar on early intervention and integrative approaches for enhancing child development. I'd like to take a moment to reflect on the insightful discussions and presentations we have had so far. Our speakers have shared valuable expertise and experiences, highlighting the importance of collaborative approaches and individualized support in enhancing child development. So now we can break for our lunch break for 45 minutes, and we look forward to an equally enriching second half of the seminar, which will resume after the lunch break. Thank you so much. Welcome back, everyone, as we resume the second half of our seminar on early intervention and integrative approaches for enhancing child development. We hope you had a refreshing break and are now ready to dive back into our discussions. In the second half, we will continue to explore innovative strategies and best practices in supporting young children's developmental needs. Let's get started. So now, I would like to invite Dr. Ridhima to stage. Let's give her a warm welcome. Dr. Ridhima, Senior Occupational Therapist, is a highly experienced occupational therapist specializing in sensory processing and neurodevelopmental disorders. Her work focuses on innovative assessment techniques and therapeutic strategies that address sensory challenges in children. Her presentation will highlight emerging trends in sensory processing assessments and the implications for early intervention. Please join me in welcoming Dr. Ridhima, whose expertise in sensory integration therapy is making a significant difference in this field.
So, first of all, I would like to thank my team hospital for giving me this platform for such a unique topic. I would say unique because everywhere where I have been talking about only the sensory integration and the intervention. Okay, so the assessment part usually is completely missed out. Unfortunately, sensory processing is something which is, as we have seen in all our the speakers who have emphasized on, right, about involvement of sensory in processing right from the womb till the just end of life, right? We keep doing it, but sadly, the diagnosis of SPD, which is completely ignored, specifically in rehabilitation field itself, it's completely ignored. So what happens is parents just come and they tell few issues of sensory, and as clinicians we all know that it's very, very common sensory issues in mostly all the neurodevelopmental challenges, right? So as soon as parents just say my child is having this tactile issues, auditory issues, clinicians just quickly jump into the intervention. It should not be done. Just be very, very careful, because sensory processing treatment specifically has a lot of side effects if it is not done carefully. And that's what we are seeing that. And that's what, when I saw the topic, it was given emerging trends in sensory processing. I was glad that finally something very, very important we are going to discuss today. Okay, so before diving into what was practiced in sensory assessment, and now how far we have reached using the technology like AI and virtual realities, how we can actually assess more, we can get a comprehensive understanding of a child's sensory processing system. Okay, the first sense to develop is the vestibular sense, and when the baby is out, so they're all sensory systems. Usually in the womb, it is all in the dark, very, very small space, dark space, no light going outside. And when the baby is out, the environment is completely different. And that is where these reflexes, what Pooja ma'am has discussed, will come and help them to survive in that opposite this thing. So if you have noticed, every aspect of our growth and development starts through the lens of sensory system. Okay, so it is imperative to not to ignore the assessment part of sensory processing. So now, so very, very simple terms, sensory processing allows us in organizing the information we take in from our bodies, that is through internal senses. Okay, what are those internal senses? Tactile, visual, auditory and olfactory. Okay, in collaboration with the external senses, it helps us how the way we interact with the physical and the social surroundings. So in the integration of the internal senses and the external senses happens together at the same time. Okay, so that to happen at the same time, okay, it again happens in a fraction of seconds. Okay, but that is the part where the maximum of our regulation happens. That is the part where a lot of our attentional issues we get to see. Okay, when all the sensory system has to integrate all together at a single point of time, all together. Okay, because that cannot happen. See, if you are listening to me and some background noises are going, okay, the filtering of the unimportant thing has to happen at that particular time only. Okay, and at the same time, your tactile system should be able to tell you that you're safe, wherever you're sitting. Your vestibular should be able to tell you that you have to keep your head erect. So all the systems have to work together. So when the parent is telling you that my child does not like the touch of any clothes, or they close ears, okay, you cannot ignore the other system, how they are working. You have to take in consideration all the aspects, all the environmental context that I will cover later, why it is important. Okay? So that is the role of external senses and the internal senses. All together they have to integrate at a single point of time. Okay? The senses must work together to do their job well, so that child responds appropriately. Thank you so much.
A language expert whose work focuses on enhancing communication skills in children with neurodevelopmental challenges. As an associate professor at MAA Institute for Speech and Hearing, she has contributed significantly to research and clinical practice in this area. Today, she will discuss the critical role of communication in child development and strategies to support it. Let's give a warm welcome to Archana ma'am.
Good afternoon, everyone. How many are sleeping? How many need tea break, coffee break? So today we'll be talking about communication, not just speech and language, in neurodevelopmental disorders, or you can also call as neurodivergent children. Okay. So before we start up, that background also, how many are SLPs? How many psychologists? OT, PT? So we have mixed crowd. Basically, we are gathered here to talk as a holistic regarding neurodevelopmental disorder, because we all are involved in the rehabilitation, identification of them. So coming on, I being a speech language pathologist, I'll be talking more about the communication. Now take home message. First of all, acceptance, inclusion and celebration of different neurotypes. So we should accept them how they are, work with them, understand them, include them and work with them. Provide affirming, personalized and effective therapy. Autistic style of communication, basically you're not going to focus on supporting the individuals, like rather than they have their own style of communication. Rather than normalizing, accept that style and modify it to up to what level it is possible. Then understand individual strengths and communication. Build trust, focus on why the child is doing this. Your observation is the key to everything. And engage the two-way perspective while talking. Emphasize capacity over the compliance and incorporate enthusiasm to your therapy session. Write the goals meaningful, etc. etc. With this, let us embrace neurodiversity, understand the autistic communication style, and always address sensory regulation in your speech therapy as well. These are my references. Thank you. Any questions?